Ladies, your hormones are being thrown out of whack. The modern world hasn't been designed for women's health.
With PMS, if we understand the mechanism behind it, we can understand why it's so common, but not normal.
3 in 4 women suffer with PMS symptoms. 1 in 10 have endometriosis, and another 1 in 10 have PCOS. And then there's acne, anxiety, weight gain, mood swings, and the list goes on.
These conditions are also often ignored and dismissed. I mean, birth control is one form of dismissing a woman, of getting her out of your office as soon as possible and not doing your work and actually digging deeper and understand what is going on.
Hormone imbalances to blame, yet we still promote the pill, demonize weightlifting, and fail at teaching proper nutrition.
There was actually a study that had women smelling t-shirts if they're on the pill or off the pill of men's sweat, and who they're attracted to changes.
If you're sick of being called lazy or told that your problems are all in your head, ladies, this one is definitely for you.
Even though your doctor tells you your experience is not real, you are not alone in this. There's lots of ways that you can support your body to come back into balance.
Welcome to the Health Optimization Podcast. I'm Tim Gray, the UK's leading biohacker. This podcast is all about gaining actionable advice from the world's top experts and sharing new breakthroughs in nature, biohacking, technology, and longevity research to help you live longer and happier. Everything I cover on this podcast are the things I've learned from the world's top medical professionals, researchers, scientists, and authors in the health field. However, I'm none of those things. I'm just someone with a very keen mind for figuring out how to be as healthy as possible whilst aging gracefully and learning from the best. Female health is being neglected, but this doesn't mean you can't conquer it. Women are often handed synthetic solutions and misled by health myths and marketing that doesn't respect their unique physiology. Thankfully, there are some brilliant women opening up the discussion and bringing awareness to the issues, including Dr. Jolene Brighten, best-selling author and leading expert in women's health. Dr. Brighten is a board-certified naturopathic endocrinologist, clinical sexologist, and the founder of Rubus Health, a women's medical clinic with an emphasis in hormonal health. Her book, Beyond the Pill, shares a 30-day program to balance your hormones, reclaim your body, and reverse the dangerous side effects of the birth control pill. And I know many women that have used Jolene's methodology and improved their hormones dramatically. And in her latest book, Is This Normal?, she answers all the questions you're often too uncomfortable to ask about your menstrual cycle, libido, the orgasm gap, vaginal discharge. Nothing is off the table. And the same goes for us today. Nothing is off the table. Dr. Jolene Brighten, welcome to the show.
Hey, thanks so much for having me. I've got the giggles right now. For everybody who's listening, I'm sure we're going to have a fun time, but man, there has been some fun behind the scenes happening already.
So, where shall we start today? I think I'm going to go straight in with it. Why should women ditch the pill?
Oh, gosh. Wow. So you are getting straight into it. Here's the thing. Birth control serves a very necessary purpose in a lot of people's lives. It's one of the top ways to prevent pregnancy that we have alongside the IUD. I mean, when it comes to birth control, the IUD definitely wins. We have fertility awareness method. And at this point, we do not have male contraception. So before I answer this question, I just want to acknowledge that I did the pill for 10 years, first generation college student, went all the way to doctor, and I controlled my fertility. Fantastic. The problem with the pill is that it is being prescribed so often, much more often, for symptom management. Now, it's your right, if you have symptoms, to absolutely choose to use any form of medication that you deem is the best fit for you when you have that conversation with your provider. But the problem is we are seeing that women are past the pill without any discussion as to why they have these symptoms to begin with. So you have an irregular period and you're past the pill. You come off the pill and you find out 2 decades later that you're infertile and you can't have a baby because that irregular period was PCOS, a leading cause of infertility, and that was never addressed. And instead, you likely got the story that so many of us do when I was past the pill. This is like decades ago, and yet it's the same thing playing out, that if you want to have a baby, you just come off the pill and you'll have a baby. Except that your acne, your irregular periods, your painful periods, your migraines, headaches, all of these things that you may be prescribed the pill for could be a sign of an underlying condition that absolutely should be addressed, because it can affect you, not just your fertility, but your cardiovascular health, your brain health, or your bone health. I mean, every aspect of your body. So that's one piece of the picture.
It's really interesting because as a biohacker, or should I say, when I got into biohacking, I never expected that I'd be talking to females about their periods or their cycles and, you know, hormones and digestive system issues when it's at certain points in their cycle and things like that. So it's quite interesting. So I was at a wedding yesterday, and one of the females there, I won't mention names or, you know, whatever, but she was like, it's very strange to be talking to a man about this stuff. And I was like, it's fine. I hear all sorts of things. You wouldn't believe how much stuff I hear these days. As a teenager, as in my 20s, I would have been cringing at it. That is in like all super uncomfortable. So it's just really funny how taboo it is. But one of the things was about 4 or 5 years ago, actually, I mentioned to her, like, if you're on the pill and, you know, I really recommend you relook at this, because she had had liver and gallbladder issues and things like this. And I was like, really, it's like, if things like this are going on, I would get off them. And then she said to me yesterday, I wasn't ready to hear it.
Yeah.
But I came off of it, and she said, I realized how numb to the world I was, and like how my emotions and mood was so stable, but I wasn't experiencing the full range of emotions. I feel like I was in a cloud or half asleep half the time. The funny thing is, I've heard this so many times.
So many
times. It's bonkers. It's absolutely, it's almost like the cycle almost goes. So what if someone is taking it not for contraception, but as a result of having endometriosis or, you know, any other health issue? What are your thoughts around that?
So first things first, if you are on birth control for managing these symptoms, you need to understand it is not addressing the root cause. It is not addressing the cause. What is the root cause of endometriosis? What is the root cause of polycystic ovarian syndrome? We don't know, because at least in the United States, it wasn't until 2024 that the government made a major commitment to actually funding women's health research. So we don't have the research. These conditions are also often ignored and dismissed. I mean, birth control is one form of dismissing a woman, of getting her out of your office as soon as possible and not doing your work and actually digging deeper and understand what is going on. So I want people to understand that. So is the case of endometriosis that you brought up. This is an inflammatory condition. This is something that every day that I work more with patients and I listen to other clinicians who are experts, they solely focus on endometriosis, and I read the research, is it becoming more and more clear that this is autoimmune. This is an autoimmune relation. There is immune system dysregulation in this. So what we know from the research is there's really this 3-ingredient recipe to activating autoimmune disease. So number one is you have to have the genes. No control there. You got to have the genes. Okay, but that doesn't mean really much in the grand scheme of things, because we know epigenetics. And if you're part of the biohacking community, then you absolutely know that there are so many interventions that you can get your genes to never express, never turn on and activate a disease if you're doing certain things. So number one, you have the genes. Number two, you have intestinal hyperpermeability, also known as leaky gut. Now, birth control is one of many medications that are known. It is known that it can lead to leaky gut. Now, everybody like just jumped on, like, we'll acknowledge NSAIDs, we'll acknowledge antibiotics, we'll acknowledge alcohol, but birth control is still one that gets downplayed. It's crazy to me when you think about any time hormone replacement therapy studies come out, their effects are always they're heightened if there's any negative side effect. It's like everyone's screaming it from the rooftops. When it comes to birth control, if there's any study that comes out with a side effect, the bandwagon is to suppress, to be like, nah, it's not that big of a deal. It is a very big deal to be messing with your microbiome. When we're talking about the pill specifically, you swallow that pill. It is metabolized via the liver. So that's first pass metabolism. This is why you can have liver gallbladder issues, but not all of it is. And some of it makes its way to your large intestine and can lead to gut dysbiosis. Endometriosis has a gut origin. There is a gut dysbiosis component to this. Now, the third thing you need to activate an autoimmune disease is a triggering event. This could be adverse childhood events. So trauma in your childhood. This could be a car accident, an acute trauma that happens. This could be an infection. This could very well be an abrupt shift in your hormones, like we see with starting your period or maybe even going on birth control. And so I want people to understand that when we talk about the combined oral contraceptive pill, that's going to be estrogen. Okay. And it is adding more estrogen to symptoms and to a disease process that is estrogen dependent. Endometriosis. So we've got immune system dysregulation. We've got inflammation, and it is endometrial-like tissue. It's not exactly the same as the lining of your uterus, but it is similar enough in that it has receptors and it responds to hormones. Estrogen will cause it to proliferate and grow in the same way that your endometrium does. And when estrogen drops, it bleeds. And when it bleeds and blood it can't escape, there's no vaginal canal because it's in your peritoneum, it's in your abdomen, it's on your bladder wall, it's on your bowels. That causes the immune system to have to come in, clean things up. And then there is more inflammation. So we've got the gut dysbiosis, we've got the inflammatory component going on, and we've got the fact that this is a condition that is basically a state of estrogen dominance driving issues. And so it is so important for people to understand that while the pill can get people symptom relief, some people with endometriosis, they go on the pill, they stay on it continually, and they get symptom relief. The reality is that there are a lot of people who are only being passed the pill. The disease is allowed to progress, and it isn't until it is debilitating that they are then sent over to a surgeon, and then they have excision surgery. Can you use the pill with endometriosis and work on the other issues? Absolutely. But somebody needs to tell you along the way, because it's not your responsibility just to inherently know that this is not a root cause approach. There is more that has to be done if you want to effectively manage this condition.
Super, super interesting. I love that, how you explain it. And I was just thinking, like, I've known several people, quite a few people actually, and a practitioner that I know here in London that has worked with people with endometriosis. And nearly every single time they've had the methylation, the MTHFR gene, one of the SNPs. So it's just really interesting because methylation is obviously blood formation, energy production, and detoxification.
And
so
the
if that's the genetic, yeah, exactly. So the methylation part of it is the common factor. And I know someone that actually was very far progressed with endometriosis, desperately wanted a kid because she was 37, and did the methylation protocol, worked on that area of her genetic side of things, and cleaned up her diet, and bingo.
Well, I want to highlight that detox piece you talk about, because with endometriosis, we know that environmental toxins, endocrine disruptors, especially xenoestrogens, are highly problematic for people living with endometriosis. They're highly problematic for every single organism on this planet, but especially with endometriosis, it can make things worse. And so if you are somebody that has MTHFR mutation, so you have that genetic variation, your detox pathways can be inhibited when you compare it to someone who does not have that. And so for you, that means you have to be more diligent about cleaning up your environment. 3 simple things. Take off your shoes before you come in the house. Do not have any fragrances in anything. And open up your windows at least once a week. Even if it's winter, I don't care. You can do those 3 simple things. You're going to drastically reduce the amount of environmental toxins that you're being exposed to, because our indoor air is one of the most polluted areas. And what does it come down to? The plug it in, like the Glade plugins, us being told that as women, we should smell like champagne and berries. Like the fact that people are like, oh, I don't want to smell. Humans are supposed to smell. They're supposed to smell. Fun fact, there was actually a study that had women smelling t-shirts if they're on the pill or off the pill of men's sweat, and who they're attracted to changes. Women on the pill, they are less attracted to masculine faces, so strong jawlines, things that are associated with higher testosterone. And women on the pill, I've had many patients report that who they're attracted to changes when they come off the pill. And I think this is something that rather than having a reflex reaction of like, oh, women are so much more sophisticated than that. Like we're not just like primal animals detecting pheromones and like, I'm sorry, I had to break it to you, like evolution's not that fast. But rather than having that reflex reaction of like, shut it down, don't talk about it, like just interesting. Because is this true for everyone? Not necessarily. But if it's true for even a handful of people, we should raise the question. What's going on there? Help me understand more. It also goes the other way, where men can actually detect women who are ovulating. They are more attracted to women who are ovulating. Now, things change with ovulation, right? Estrogen's up, skin is more plump, lips are more plump, breasts are more full, hips are more full. All of these things that signal like, hey, I'm fertile visually, but also on the biochemical level. And there was an interesting study where they showed that strippers actually got tipped more when they were ovulating.
I'm so glad you mentioned this, because I talked about this on my Instagram a couple of years ago, and a forum dedicated to hating on Tim Biohacker popped up saying he even talks about strippers and this and that and the other. But it's actually a very interesting study, isn't it? How they get tipped more and made more money as a result of not being on the pill. If
we did it in any other industry that does tipping, and that's unique to the United States, so let's like take it to waitresses, I am sure we would see the same things. But, you know, in a strip club, it's like people are already throwing money for a very primal reason, right? It's about sex. So, you know, I don't know if they necessarily want to go into like other industries. Like, does your masseuse get tipped more? Like that might be uncomfortable, but it is just something that's very interesting, because where is the study that asks the question of what happens when we medicate an entire population of women and we take away that ovulatory cycle? What happens to the testicle owners? What happens to their hormones? What happens to that? We don't actually know. You know, there's a lot missing in the conversation of birth control. You know, after birth control hit its 50-year anniversary, there was a study that came out and was like, you know, for the fact that we've had this medication for 50 years, we actually know so little about it. Like we are living in such a weird time in which we have no study that tells us what happens to women when you put them on the pill, you know, in their early years, just following menarche. So starting your period. So we put a 14-year-old, 15-year-old, 16-year-old before her brain has fully formed, which depends on these hormones, before ovarian communication with the brain has been fully solidified, like before optimal bone density has been achieved. Where are the studies saying what happens when we start that and then 30, 40 years later, she comes off the pill and now she's in perimenopause? We are told by so many clinicians that it's safe because the absence of evidence says so. The same people who are like coming out criticizing you and I, if we're like, hey, there's some evidence that says this, and they're like, no. Like we only practice evidence-based medicine. The absence of evidence does not confirm that your belief, which is, let's be real, that's what it is. It's a belief. It's not based in fact, is in fact true about women's bodies and women's experience. And I will say the fastest way to understanding what is going on with the pill is just by listening to women who have that experience. It's where, you know, my book Beyond the Pill, so much of that, you know, what got me curious, diving into everything wasn't even necessarily my own personal experience, but hearing the experience of my patients, which validated what I went through as well. But hearing all of that and being like, wow, that's interesting. Let me look. What research do we have? What can we understand? And so I think it's so important that in this day and age, we maintain humility in medicine and recognize that we don't have all of the answers to a medication that mostly, when the side effects come up, have been completely ignored because it's all been in the name of like women's lib, without ever asking, is this actually serving every woman in the way that we intended?
So with regards to methylation and blood formation and detoxification, one thing I just want to, you know, get your opinion on is that if you have the methylation SNP for your genes, so your methylation is downregulated and you're vegan, that is the perfect storm, in my opinion, because you're not getting enough B12, and B12 is one of the drivers of methylation. You need more folate, which you may or may not be getting depending on how many of the greens you're actually eating. But then as a result, things like endometriosis obviously get significantly worse because not only do you have downregulated methylation cycle, but you also aren't feeding yourself with the right stuff to upregulate those genes even more, which is why, people supplement with B12, but that's only part of the picture. I mean, have you seen anything along these lines, or are you of the same mind?
Protein doesn't just happen. I just really want people to understand protein doesn't just happen in your diet. And that is something that a lot of vegans and vegetarians will often, I've heard them say, I was a vegetarian for 10 years. When I tell you how neurotic I had to be about counting grams of protein and how I was eating like 6 to 8 eggs in the morning just to try to get enough every single day. So why do I start and bring up protein first? Because without protein, you cannot detox. You require amino acids for your liver to do its job. You have to be very diligent about what protein is coming in. And I think people need to understand that veganism, and if you're vegan, like you can do you. You don't have to take anything I say and decide to do anything with it. And I'll be okay with that. But what I want you to understand, that is a extreme restriction, and it's a privileged form of restriction. You are living in a state where you can supplement with B12. And there's a lot of people in the world who aren't able to do that. I will also say that as much as like people don't like it when I say it, organ meats are one of the most nutrient dense foods. And when it comes to the ovary owners are set up to sense the environment. We need more sleep. We need less stress. We need more nutrient density. Is that to say a woman isn't resilient? No, that's not to say that. It is to say that because biologically speaking, our bodies are programmed to have a baby, whether or not we want one, whether or not we can actually have one, because we are set up in that way, we are much more sensitive to the environment. If you're eating in a way that says there is scarcity, that can negatively impact your hormones. But when I get really concerned about veganism is when people are eating ultra processed food under the guise that it's a health food. I would just straight out, but people, gluten-free does not make it a health food. Vegan does not make it a health food. It can still be ultra processed. You look at some of these vegan foods and you're like, wow, someone went to chem lab. Like this is a lot of ingredients. Now, to the point of endometriosis, if we're talking about bringing in all of these ultra processed foods, these can be inflammatory. A lot of these vegan foods are going to have things like canola oil in them. This is just one of a billion examples I could bring. That is going to be a pro-inflammatory oil. If you are someone who has painful periods, whether it's endometriosis or not, if you are someone who experiences the period flu, that is before you get your period, you feel achy, you feel icky. If you're somebody who feels really irritable and angry, if you get diarrhea with your period, you have a prostaglandin issue. Prostaglandins are made from omega-3s or omega-6s. Eat more omega-6s and you will find yourself in prostaglandin hell. Eat more omega-3s and they're going to be effective to help you shed your endometrial lining, but not so hot and bothered that they're causing inflammation, horrible periods, and period diarrhea or the period flu. And so this is another consideration with the vegan diet. I see a lot of omega-6s coming through instead of omega-3s. It's very important for people to understand because they will say like, oh, you can get omega-3s from plants. You're not a cow. Okay. You don't have a 4-chamber stomach. It is not that easy to actually convert those precursors because that's what it is. It's not straight up omega-3s. It is the precursors. It's not that easy to convert those. Are these plants helpful and beneficial and you should eat them for a variety of reasons? Absolutely. But this is where I'll see people, they have to start supplementing with algae. They have to start bringing in other supplements when they could have had some cod liver oil. They could have ate cold water fish, which is also going to give you selenium and iodine, which your thyroid loves. Another condition that can arise with veganism is hypothyroidism because of the low iron, the low B12, the low nutrients that are coming in. So am I saying you could never do veganism right? No, I think there are people out there that can do it really well. But I also look at it as like, how much time and energy do you have to dedicate to being so meticulous about your diet, especially if you know you're someone who's set up with an MTHFR hindrance, so to speak. Like you didn't get the full capacity, so you got to work a little harder as it is. How hard do you want to work? And in the grand scheme of things, where do you want your energy to flow every day of your life? Do we want to be all consumed by our diet? As somebody who has a nutrition science degree, I hope it's a no. I hope it's a no. I hope that your diet is set up in a way that serves you and is easy enough that you can give your energy, your attention, and your gifts to what you really came for in this life.
Yeah, it's a very complicated puzzle. I guess the summary is if you haven't tested your genes and you're vegan and you have endometriosis or you have hormonal issues, then I would get your DNA tested. We have a few brands that come to the Health Optimization Summit. One of them is Self-Decode, which is actually my favorite of the moment, just because of the analysis it goes into, but there's some very, very good ones out there. Remember, if you want to learn how to take control of your health and you're sick of traditional healthcare and temporary fixes, you should come to the Health Optimization Summit. You can join other like-minded enthusiasts and meet the world's leading minds in health, wellness, and science. You can even test out a load of groundbreaking health tech and latest supplements. Get your tickets at healthoptimization.com. What are the most common hormonal issues that affect women? And, what kind of symptoms are associated with them?
So when we look at symptoms of hormone imbalance and things like PMS, that's roughly 90% of women have experienced this in their lifetime. And the other 10%, maybe they just, I don't know, have had a really good life, or they're not ready to admit that they're not having issues. Because I think it's very hard to be human on this planet today and not have issues of hormone imbalance at some point. So when we say hormone imbalance, what are we talking about? So some common things we see. Your periods are irregular. They're, not coming predictably, or they're coming greater than every 35 days. You experience acne, oily skin, maybe hair growth on your chest, maybe losing hair on your head. That's pointing towards polycystic ovarian syndrome. Some studies cite that as many as 18% of women may have PCOS. We know it takes on average 2 to 3 doctors before you'll get this diagnosis. As the case of endometriosis, this is where there can be painful periods, pain with sex. Pain can be a resounding symptom, but it can also be that maybe you have urinary changes. Maybe your bowels are changing. Maybe you bloat horribly before your period. This is where I will often see doctors jump to either IBS or small intestinal bacterial overgrowth. You can still have small intestinal bacterial overgrowth and have endometriosis. However, if somebody is bloating a week or 2 before their period and it's pretty extreme, we need to investigate endometriosis, because that is a very common symptom that women experience. So right there, your hormones aren't isolated to your reproductive system. Your hormones affect every single system in your body. If you're finding that you have dry skin, hair loss, fatigue, you're really cold, and you're gaining weight no matter what you do, this is where we start looking at hypothyroidism. So that's another very common condition that we see among women. I would say PCOS, hypothyroidism, and the PMS, PMDD, these are the, camp of the most common things that I see. And PMS, premenstrual tension syndrome, this is something that can be feeling, a little bit bloated before your period, a little bit weepy, maybe having trouble sleeping, feeling more irritable, all these things I just explained. It's looking like a low progesterone. Whereas PMDD, which is premenstrual dysphoric disorder, this is much more extreme. And this is where you have the physical and the emotional symptoms of PMS, but amplified. It lasts longer, so 10, 12, maybe 14 days out of the month. And it may even be something where you have suicidal ideation. You feel like ending your life. You're so depressed before your period comes. Now, what's interesting about PMDD, and is something that I am really a big advocate for, is if you've been diagnosed with PMDD or you feel like you have extreme PMS, you need to be screened for autism or ADHD. Over 90% of those with autism are affected by PMDD, and almost 50% of those with ADHD are affected with PMDD. And it doesn't even have to be that extreme. It could just be PMS. There is something about the neurodivergent brain that is much more sensitive to the shifts in estrogen, to which serotonin and dopamine follow, to progesterone and its metabolite, that can stimulate the GABA receptor in the brain and should make you feel calm, but in some brains, it doesn't. And so while you may have something that your doctor's like, PMDD is one that often gets past the pill, and it does work really well sometimes, while your doctor may be like, hey, just take the pill and send you on the way, you may actually have a more serious issue going on. Autism and ADHD, those require ongoing, your full cycle, your full lifetime, especially perimenopause, support. You need accommodations to be able to thrive in this life.
Interesting, as you're saying this about PMS and whatnot. And I remember back to a book I read called The Yeast Connection. And obviously that ties in with autism, it ties in with PMS and various other things. And like actually interesting in the study, there's like the women that were tested with severe PMS actually were very high in yeast. And obviously when they're very high in yeast, their guts weren't correct, their livers were stressed, their hormones were all over the place. And often that's tied back. And this is my further research at the time of reading is around methylation again. So it comes back down to not detoxifying properly, and then it creates this whole stress on the body, which then eventually leads to, I mean, it's just the body trying to compensate because it doesn't know what the hell's going on, and it's just doing the best to survive. And yet this is what happens. It's quite interesting. So you say that 3 in 4 women experience PMS, right? So why is it so common if it's not a normal part of someone's cycle?
Yes, this is such a great question. You know, who goes to the doctor? People who are sick. So who do doctors see? People who need help, people who are struggling. So your PMS has gotten to a point where you need help. So with PMS, if we understand the mechanism behind it, we can understand why it's so common, but not normal. So there's the stress component. There's the lack of sleep. There is the environmental toxins that we're experiencing all of the time. And if we just take it from the lens of progesterone hates stress. It does not like it. Not a fan. It doesn't like you skipping meals. There is a way to intermittent fast. I want to be clear with that. But if you are feeling hangry, if you feel hot, if you feel anxious, if you feel like, oh gosh, I need to eat right now, and you're in your luteal phase, you are ignoring very important stress cues from your body. Progesterone likes vitamin C, vitamin B6, community. Vitex is an herb that can help. So with progesterone, if we are experiencing higher stress, the brain will actually signal that we need to stop the mechanisms that would bring us to procreate because the environment's not safe. So we talked about this before. The environment, the input has to be, this is safe. Because if it's not safe, it's not a good time for you to be vulnerable with a pregnancy or vulnerable with a small human who makes a lot of noise with predators around. Like these are not good things to have. And so your body being very wise is going to say, okay, let's dial back that progesterone production. So when progesterone comes down, estrogen is left unchecked. And now estrogen is stimulating tissues at a time where that diva should be taken the backstage. And so we've got irritability. We've got water retention. We've got bloating. We've got just symptoms of feeling unwell. If it's stimulating histamine as it can, that's where that like period flu, that feeling of unwell comes in. Now, that's the first mechanism. Stressors are coming in. Let's dampen down progesterone production. There used to be this concept called the pregnenolone still. Pregnenolone is the mama hormone, gives birth to cortisol, progesterone, and others. And we used to think like stress stole it away. What we now understand is the brain actually orchestrates it that way and says, make stress hormones at the expense of your progesterone. So you likely have high cortisol and low progesterone going on. So that is one of the primary reasons that we can see for experiencing PMS. And by the way, as that continues, the next thing that comes, you don't check that stress is the body's like, we're not going to be interested in sex either, because that's also dangerous and risky. We could get pregnant. So when you understand that, the studies on sleep saying you need 8 hours a night, those were actually done on men. Shocker. And they just said, apply it to women. And in reality, women likely need more than 8 hours of sleep, maybe more like 9 or 10. I've talked about this for years. I'm someone who does better with 9 hours of sleep. And people are like, that's so crazy. I'm like, I track my data. I know this is what works for me. When you get into your luteal phase, you may even need up to an hour more. When you consider that the average American, so, I don't know how it is in the UK, but in the United States, people are getting more like 5, 6. They're lucky to get 7 hours of sleep. I show in my book a diagram in Is This Normal? How chronic sleep deprivation, which is what happens when you only sleep 6 hours a night, night after night after night, you get into this deprivation. Your savings account becomes depleted. You can't replenish it. Just that piece alone can lead to increased inflammation. That's a stressor. We need cortisol for that. Blood sugar dysregulation. That's a stressor. We need cortisol for that. Downregulating the thyroid from producing hormones. If we do that, we won't develop follicles. We won't ovulate. Now we have irregular periods. Now we have PMS going on. And lack of sleep alone can cause dysregulation of the menstrual cycle. So that's just the sleep component. Then we've got people are stressing, right? All the time. So we've got high stress. People don't realize when I'm talking about stress, so often my patients are like, oh, I don't think I'm stressed at all. I don't feel it. And I'm like, do you live in an urban area that has lights all the time? Does light come into your window? That's stress. Do you commute in a car? Okay. When you first started driving, that was stressful. Now your brain's running in the background. It is still stress. When we look at the way we live in our modern society, it is highly stressful. We just went through daylight savings time, and I told people, if you can help it, try not to drive the first couple of days. And people are like, you're crazy. I can't do that. You can't do that because the way we are set up to live is not congruent with the way our biology has evolved.
But there's actually, I think there's studies done of when the clocks change by just 1 hour, car accidents go up by 25%. And also so do cardiac arrests.
Yeah.
Exactly. And so, I did 10.5-hour time shift from India to Miami a few weeks ago. And it's the most brutal thing that I will never, ever, ever, ever do again. And it's like the amount of stress it puts you under is just ridiculous. So, can you actually lessen or stop PMS by getting your hormones on track?
Absolutely. Yes. That's the primary way that we're going to be able to achieve this. So, you brought up yeast overgrowth in the gut earlier. I think that is a fantastic thing for people to understand that gut dysbiosis. So when we talk about yeast should be in your gut. It is normal, but it is opportunistic, just like in your vagina. And given the opportunity, that critter is going to overgrow. And so when we have gut dysbiosis, that is an imbalance of the bacteria that really throw down. I call them the bouncers of the gut, where they're just look, like a couple of rowdy little riffraff coming into the club. That's a good time. Too many of them, we got bar brawl. That's a problem. And so you got the bouncers in the gut who are keeping everybody in check. When there's gut dysbiosis, we will see shifts in an enzyme called beta-glucuronidase. Imbalances in beta-glucuronidase can result in reactivation of our estrogen that the liver had processed up because you didn't need it anymore. The liver's so we talked about liver detox early on. Super, super important. Phase 1, phase 2 liver detox. The liver's you don't need this estrogen anymore. Package it up. Let's move it out. It's got to go through urine. Drink your water. I got my electrolytes over here right now. So drink your water, stay hydrated, and you got to move your bowels. And you've got to keep the bowels healthy. Because that dysbiosis, that beta-glucuronidase can reactivate the estrogen. Now we have more estrogen than was intended going into circulation. What's interesting to me is I will see doctors saying, oh, this doesn't have any bearing or any effect on your estrogen levels. This can't be related to PMS. This can't be related to your issues. And then you go look at cancer research. That's this is a problem. For estrogen positive cancers, what is happening in the gut is a big problem. And that is because we have the estrobolome in there. The estrobolome, it's part of how we keep healthy estrogen levels. It's also part of how we keep a healthy vagina. So super, super important. So we talked about the liver. The gut is the other piece. And this is where I always start in my practice with patients. And people are always surprised because they're like, I thought we were just going to go and address my hormones. And I'm like, well, we got to talk about insulin. We got to talk about cortisol. We got to talk about thyroid. I know you're after the sex hormones, but that is the foundation of these. But also, if your gut and your liver aren't being given what they need to thrive, they're not going to be able to do their job so that your hormones are optimized. So as I said, stressors, gut dysbiosis is a stressor. Yeast overgrowth is a stressor. A chronic infection is a stressor. So if you're listening to this right now and you're like, oh my God, what can I do? Number one is let's get your fiber up. Here's my goal for you, 25 grams a day. Men, 30 grams a day. And there's people who are like, oh, do more. If women, you should eat like 30 to 50 grams a day. That can actually tank your hormones. We do not want to do that, okay? We don't want to jump there. But if you are somebody who's only eating 10 grams of fiber a day, I challenge you to increase it by 5 grams a day over the next week. And then the next week, add another 5 grams until you get to 25 grams. We don't want to just jump to 25 grams tomorrow because you will hate me and your gut will be a wreck. But feeding your body fiber, that is going to help with microbial diversity. Wherever you're at, start it now. Because as your estrogen declines post-menopause, we are going to see that your microbial diversity tanks. That is going to drop drastically. Microbial diversity is associated with less belly fat. Okay, we all want less belly fat, right? Because that's visceral adiposity. I want people to understand that. People always jump in with their anti-diet culture stuff, and I'm like, great. You do you. But listen to me when I say that belly fat, what you're seeing is a muffin top. You've got fat packing around your organs. That is some of the deadliest things that we find when it comes to metabolic health. Like, you should not have fat packed around your organs. Increasing fiber. So 25 grams, get it up. Sugar, added sugar, less than 25 grams. So 25, this can shift visceral adiposity. Okay. That shift in visceral adiposity means less inflammation, less estrogen production, less hormone imbalance. And by eating in that way, you've more gut biodiversity. And if you have that biodiversity in your microbiome, you're going to have better hormones overall.
You've mentioned many women experience PCOS, and I seem to be hearing it everywhere all the time at the moment. And obviously, as we now know, it's an early sign of diabetes. What works to manage PCOS, would you say?
Oh, okay. So I love that you brought up the diabetes piece, because PCOS has actually been termed the diabetes of the ovaries. And this is because 70% or more of women with PCOS have insulin resistance. When insulin goes up, it stimulates the ovaries of someone with PCOS. This doesn't happen in everyone, but it stimulates them to produce more testosterone. Now, really interesting. We have been screaming about diet and lifestyle management. We, as in, people who are about root cause interventions and really empowering people to thrive and to overcome chronic conditions. PCOS has been one of those. It wasn't until 2023 that the new guidelines came out and they finally put doctors in their place saying nutrition and lifestyle should be first-line intervention for every single patient with PCOS, because it is the most important and it is among the most effective treatments. Now, unfortunately, the average provider didn't get any of that training, or they got like 20 hours and they're out there being like, we're actually the experts on lifestyle medicine. And I'm like, sit down. So they're not going to necessarily be able to talk to a patient about this. This is where leveraging nutritionists, registered dietitian, health coaches, because let me tell you, as a doctor who is like, hey, we need to do these lifestyle things, it is very hard for the average patient to do this on their own. They do need that extra support. So with PCOS, that 25 I just talked about, absolutely crucial. No more than 25 grams of added sugar. And for everybody listening, we were addressing moms before. Every time my boys go with me to the store, we look at packages. One of the most powerful things you can do is teach your kids how to learn to read those labels, because I work with women in their 40s and 50s who have never looked at a nutrition facts table, and it's intimidating to them. And you would be shocked at how much sugar is coming into your gluten-free, your vegan, your pseudo whole food packaged foods. It's a lot. So the fiber, the sugar, very key. Strength training, absolute must. Every human on the planet needs to be doing this. My master's research was in sarcopenic obesity. I explained this as the round M&Ms man. You put all your fat around in the center and you lose all your muscle in your legs and your arms. And what we understand is that big muscles help with insulin because they help sensitize you to insulin. They're also, big, thick, meaty thighs associated with more mitochondria in the brain. Guess where else you have tons of mitochondria? In your ovaries. So all the stuff that you learn to be doing to help your mitochondria for your brain health, for your heart health is absolutely awesome for your ovary health. But you have to also keep in mind that you are a woman, which means you can't be going the extremes of the studies that have been done on men. So PCOS, we've got to be exercising. We've got to be managing our diet. Whole foods, you get very little wiggle room whatsoever, and it sucks. And I just want to honor that for people who are in it. I have patients all the time that are like, I feel like if I deviate at all, my face explodes in acne. And I'm like, it is so unfair to watch somebody drive through the fast food window and their skin is clear. It is lame. It is not fair, but it is just not the cards that you were dealt in this lifetime. And I always frame it as celebrate what you are doing here, because PCOS isn't just a fertility issue. PCOS leads to increased risk of diabetes, which we know increases the risk of dementia, which we know women are primarily affected by. It also increases the risk of depression, anxiety, and cardiovascular issues. So everything that you do now makes such a difference for that. The other thing I would say, I talk about nutrition, lifestyle, even though I own a supplement company, I'm always like, we need to start there with these basics. But myo-inositol is one supplement. It's a B vitamin-ish nutrient, specifically myo-inositol and D-chiroinositol. This blend of a 40-to-1 can help with ovarian function, helping restore ovulation, insulin sensitization, helping with your androgen levels. And so we know that this supplement can be very effective in people who maybe they require metformin, but metformin, which is a diabetes drug that helps with insulin sensitization, people that require metformin but fail it because it causes extreme side effects like gastrointestinal issues, they do really well a lot of the times with myo-inositol. And so there's actually a lot of supplements that we could talk about with PCOS, but I will say that if you are not tending to your nutrition and making sure that you are exercising regularly, those supplements will only take you so far.
Yeah, super on point. I love hearing all that, especially around super high testosterone and too much sugar, i.e. pre-diabetes or whatnot. It's very, very interesting. So something I want to move on to, which is a topic when I heard it probably 5 or 6 years ago now, I couldn't believe I didn't know it my whole life. And this is as a guy, but it's around the female cycle and what happens throughout the month and how hormones change, or the levels of hormones, and how you can be fertile in a certain window, but not the rest, even though, the doctors don't seem to ever tell you this, especially when you're trying, for instance, to have a baby. It's like, It just seems so crazy. So tell us, why should women track their cycle?
Oh, you talked about getting into the biohacking community and not thinking about how much you're going to talk about periods, but you want to talk about the OG biohackers. It is women and their cycles. And if you ever want to know exactly what is going on with, your body in sense of like, how is stress affecting you? How are the changes in your lifestyle affecting you? You've been improving your sleep. What's going on? Track your cycle. It is so telling. So the average menstrual cycle, we've always been told, is 28 days. It's actually not. That's a very few percentage of women have a 28-day cycle, but it should be regular. It should be more in that 24 to maybe 32-day range. And, I say there's this range because it really can be a range. If it's coming, haphazardly every month, we've got a problem. And as you brought up, we're so often not told that you can only get pregnant one day out of the month. People will say women are fertile for 6 days out of the month. I'm like, I hate to break this to you, but you have one day, 24 hours, maybe if you're lucky, 36 hours for sperm and egg to meet. That's it. Why people that's a myth in itself, right? Myth is you can get pregnant every day of the month. Then the next myth is women are fertile 6 days out of the month. We are in fact not. Okay. We can only get pregnant one day out of the month, but sperm can live 5 days. And that's important to know. I like to call them like loitering little hooligans, but in reality, it is your body keeping them alive. Like, they're just hanging out. They're waiting to like meet the egg. And if the egg's like, you're cool, I'll let you in, then it gets fertilized. Fertilization actually happens in the fallopian tube. So here's another thing that you're not usually told until you try to get pregnant. So firstly, you are going to have sex in a 3 to 5 day window to try to catch ovulation. So sperm and egg can meet. Then once they meet, fertilization actually happens in the fallopian tube. It doesn't happen in the uterus. That blastocyst, little ball of cells, has to travel down the fallopian tube and implant into the endometrium. I actually just had a patient recently whose luteal phase, so from the time she ovulated until she got her period, was 8 days. And she said to me, and she was really panicked because she was like, oh, we've been doing all this stuff together and I'm late on my period. And I'm like, okay, say more about that. And she says, oh, well, I'm late on my period because I'm getting to, this is now like 11 days on my cycle, like total, so day of the period until the next of my cycle. And like, I'm getting really nervous about this. And I'm like, okay, remember when we talked about what the goal was? You're trying to get pregnant. You can't get pregnant if your luteal phase is less than 10 days. So from the time you ovulate, if your period is coming sooner than 10 days, you don't have enough progesterone that's actually stimulating the endometrial lining, because that little ball of cells, that embryo, when it lands in the uterus, might be day 8. It could even be day 10 in some people. But if you don't have enough progesterone to keep that endometrium around so it has a place to land, then you're never going to get pregnant. And there's a lot of women who don't understand that as well, that luteal phase needs to be a certain length. So maybe you're thinking, you're listening to this, you're like, but I don't want to get pregnant. Well, I would bet you're having PMS. I would bet you're having issues with your hormones, because we need at least a corpus luteum, that's the temporary endocrine structure left in the ovaries producing progesterone, of at least 10 days to really feel optimized with that. So why should we be tracking our cycle? Well, there is, like, if you want to get pregnant, but there is so much intel about your own hormones. I cannot test you every single day of the cycle. You would hate me for that. Your hormones wouldn't even be accurate, because if I'm sending you to a lab to get a needle stuck in you every single day for 28, 30 days, you're going to be stressed. It's going to be a problem. And even the at-home tests that we have, there's testing that we can do like frequently throughout the cycle, but that's still not going to give a full picture of what's happening to your health. Really, the best of clinicians will always interpret your labs through the lens of your story, of your experience, because reference ranges are great for knowing who has a disease, but they're not great at knowing what your range and your normal is.
Can cycle tracking replace other contraceptive methods like condoms, the pill, or the dreaded pull out and pray method? Obviously, with hookup culture and multiple partners or new partners, this obviously shouldn't be taken lightly for obvious reasons.
I don't care if you're on the pill or if you have an IUD, or you use the pull out method, or you use fertility awareness method. If you have multiple partners, you need to have a barrier method. And we don't talk about this enough, but like STIs are real. Okay, they're real and they can lead to infertility. They can be a form of chronic infections. Again, stressor on the body, and you might not even know if you have them. So to your question, fertility awareness method, so cycle tracking, is not what fertility awareness method is. So fertility awareness method is you're going to temp check basal body temperature every single morning. You're also going to be looking for signs like fertile cervical mucus. If you have slippery mucus showing up when you use the restroom, friend, you are in your fertile window. You are at risk of becoming pregnant. If this method is practiced correctly, it is as effective as the pill. Okay. But to practice it correctly, you can't use the pull out method when you're in your fertile window. You can do other kinds of sex, Or you can use a barrier method. You have to have a backup method. And so many times when people are like, fertility awareness method failed, I ask more questions. They're like, well, I use the pull-out method and I'm like 1 in 5 become pregnant in a year. That's not the same. Your primary method was the pull-out method then. That was the primary method. So yes, in certain people, it can be as effective as hormonal birth control, so the pill specifically. However, you have to use it correctly. And if you have irregular cycles, you are a night shift worker, even if you have something like hypothyroidism, it may not work for you unless you get with a fertility awareness educator who can really help guide you and fine tune that.
Amazing. So right at the beginning of this journey today, we spoke about the dangers of the pill. And if the person listening to this today wants to transition off of birth control, like how and where should they look or start?
Okay, number 1 is, why did you start the pill? And number 2 is, do you want to get pregnant? If you don't want to get pregnant, have a backup method immediately. If you started the pill for symptom management, as I talk about in Beyond the Pill, you need to give yourself at least 3 months of working on at the root of what could be causing those symptoms so they don't come flooding back when you come off of the pill. The pill depletes your nutrients. So anybody who is on hormonal birth control should be on a prenatal or a multivitamin on top of their diet to replenish nutrient stores. As I said before, dysbiosis is not your friend, and birth control can be leading to that. So making sure that you are tending to your gut health is super, super crucial, and fueling yourself with everything you need to do liver detoxification. I talk about a couple more steps in Beyond the Pill. There's really like 5 areas that I work on with people to address what the pill has done, regardless of what your symptoms are that drove you onto the pill, so you can transition off and not experience symptoms afterwards. So what gets called in functional medicine post-birth control syndrome, the collection of these signs and symptoms that arise when you come off of birth control. And I know there's people who have experienced this, and I want to say, even though your doctor tells you your experience is not real, that's not correct. In fact, the researcher, Dr. Sarah Hill, just did a survey and found and validated that a lot of women come off the pill and experience symptoms that they never had before. So you are not alone in this, but it also means you don't have to struggle either. There's lots of ways that you can support your body to come back into balance.
Also, the knowledge and people such as yourself talking about this and writing books, and like the data is growing quite significantly, very quickly, actually. I think it's becoming more and more prominent, and this is why I really enjoy talking to you today, because I feel like my audience haven't really heard about this. And I have, quite a large female following these days. So finally, what's the number one thing that a woman should start doing right away to regain control of her energy and her hormonal balance?
Oh gosh, there's so many directions. Oh, there's so much I want to say. Right now, I want to say that definitely, as we are seeing a large percentage of the population moving into perimenopause and subsequently menopause, strength training, building your muscle mass now, and strength training, that's going to sensitize you to insulin. It's going to help with optimizing estrogen and testosterone. As you exercise, you're going to get more oxygenation of your tissues, more perfusion, so blood flow to the uterus and to the ovaries. And you're also going to strengthen your pelvic floor, which makes for better orgasms and less chance of urinary incontinence.
Dr. Jolene Brighten, it's been an absolute pleasure. Every time we speak or hang out, it's always so much fun. So thank you very much for coming on today. I'm so happy you've been on the show.
Absolutely. Well, thanks so much for having me. I'm so glad that we were able to connect and make this happen.
A massive thank you to my guest, Dr. Jolene Brighten. Learn more at drbrighten.com and follow Dr. Jolene Brighten on Instagram. You've been listening to the Health Optimization Podcast. I'm Tim Gray. Comment and leave the video a thumbs up if you enjoyed it, and subscribe to my channel to see more. See you next time, and remember, let's spread the health.